According to the National Coalition on Healthcare, in 2006 over 68% of American citizens belonged to some type of healthcare organization and were covered under the insurances provided by the physicians. In addition to those 68%, over 82% of the American population believed that the healthcare program should be reformed because of the financial standing of the economy. Healthcare is the prevention, treatment, and management of illness and preservation of mental health through the services offered by the medical, nursing, and allied health professions. As the American society already knows that since September 11th, the whole United States economy has been continuously declining, resulting in worldwide problems such as stock market instability. Stats show that after September 11th, the economy plunged to an all-time low for the Dow at 9,605 points. Although toughing the period of time out, the market eventually began to rise to 11,331 points in 2006. Assuming from the particular trend that the economy would continue to rise, in 2007, the Dow peaked at a 14,165 point mark in October of that year. Conversely, within the past month, the market has been falling with the Dow hitting a new low. In addition to the stock market plunging, the amount of money spent to cover 11.7% of our population's health care by the United Health Group added to $66,768 per year. This stat means that the health care is very costly for the government. For example, if it costs $66,768 a year, the whole United States would be consuming about $534,000 per year per person. Mandating free health care would possibly allow for the economy to peak at a national high for debt by comparing stocks and financial standing. In addition to increasing national debt, free health care would then lead to the overcrowded hospitals. Since the American population no longer has to pay for the services, the people will go anywhere as long as it's free. In relation to our financial standing, people are always trying to save money, and so is free health care supposed to fit into this. And in the society today, one doctor sees about 42 patients within their daily schedule. Imagine if that number doubled or even tripled. What would happen to the hospitals? If more and more people continuously swarm to the health facilities, causing the places to become overcrowded, then all the doctors will be worked excessively because they're worked by struggling to help as many people as possible. On average today, doctors work 9 to 10 hours. During the day, not counting the night calls they receive, and well over 60 hours a week. Since the surgeons and physicians will be working over the average hours, the students wanting to become doctors could possibly change majors, thus raising the demand for doctors in the United States, adding another national problem to our country. The government will be expecting the money from the citizens to pay for health care and the doctors. Since the government would be relying on the citizens to supplement this money, although how would they plan to receive the right amount of money to support health care? Working families take 6.2% out of each paycheck to provide for the health care section, and a total overall tax about 15.3%. This implies that the government gets its money from the loyal taxpayers who have jobs. But in return, the citizens have to pay their money back to the source to support those who are lazy or simply can't work. As the economy continues to fall and the government questions raising taxes, what happens to the insurance companies? If mandating free health care makes an effect on the economy, the insurance company would not have to pay for anything. In return, the insurance companies would eventually go out of business. Also, this effect would lead to the rise in unemployment because over 14.9% of our population works for the insurance companies. Conversely, as of 2005, nearly 47 million Americans did not have insurance anyways, allowing the insurance agencies to still be in business, the other half of the population funding that whole business. Since the economy is already in debt, why add to it? If adding to the national debt raises taxes, why cause a society turmoil leading to another additional confusion? If the event of free health care occurred, insurance companies would not be needed because it's all free. The government is the insurance company. The United States does not need the confusion right now. Although in the future, it might be a possible scenario under right circumstances. Free health care would cause more than enough declining factors that could cause an economical downfall, leading to a possible raise in taxes and insurance companies being destroyed. My works cited are CNN Money, Expenditures Chart, Health Insurance Employment Chart, Healthcare Reform and Improvement, Types of Insurances, Health Insurance Coverage, Weekly Schedule for Doctors, and Daily Reports Form for Doctors.